very common, and majority of the, as I said, like in US, for example, 50% of the people who are diabetic, they suffer from cardiovascular disease, and people who've got diabetes, they're more likely to have heart disease 2 or 4 times more than the normal population. And a lot of these people who got diabetes, they die, unfortunately, from cardiovascular event eventually.
Hello and welcome to the 4th and final episode of the Golf News vodcast series Heart Matters in association with King's College Hospital London in Dubai. I'm Lachlan Kitchen, and in this final episode of the series we're going to discuss the link between diabetes and heart disease and the impact of these silent killers. Now, many people don't realise that diabetes and heart disease are deeply connected. And in this final episode of this series, we're going to look into the impacts high blood sugar has on your arteries, just how common the overlap is, and what preventative steps diabetic and pre-diabetic patients should take to protect their hearts. Joining me in conversation is Dr. Layla Al Marzooqi, the specialist cardiologist and aeromedical examiner at King's College Hospital in Dubai. Dr. Layla graduated from the Royal College of Surgeons in Ireland, has a master's in cardiovascular rehabilitation from the University of Chester in the UK, and a PhD with distinction, I might add, from UAE University. She is a fellow of American College of Cardiology and associated professor in Sharjah University. Dr. Layla, it is a pleasure to have you here on this final episode of the series. Thank you for coming in.
Thank you for having me, and thank you for the nice introduction.
Well, it's lovely. And hearing about how you studied in Ireland, we were just discussing before, you've got this wonderful Irish twang to your accent. But we'll get on to serious matters first. Doctor, if you can tell us, what is the connection between diabetes and an increased risk of heart disease?
This is a very interesting topic, and a lot of people think about diabetes as having just high blood sugar, but they don't know that it has got so many other health implications. It is underestimated. It is a serious disease, but the awareness of the people, unfortunately, it's low, and we need to increase that awareness to teach them that there is a great connection, not great, but big connection between diabetes and heart disease. In US, for example, there are 80 million people are diabetic. 50% of them, they've got cardiovascular disease. And majority of the people who are diabetic, they don't know that they're having a heart disease or cardiovascular disease. And the connection is very important. And because it has great consequences, health complications that happen could lead to death as well.
Is it the same for both type 1 and type 2 diabetes, that correlation?
Correlation is the same, but because people who are in diabetic type 1, they get it much earlier, and they get it as a child as well. So the complications tend to be earlier, more severe. Like, for example, a lot of people who are in diabetic type 1, they develop heart disease earlier. They need to go for kidney transplant, for example, compared to people who are diabetic type 2. But both of them, they have the risk.
Why is heart disease often known as the silent killer in people that have diabetes?
Diabetes itself is a silent disease. This is what I call my patient. I tell my patient. I tell them that hypertension, high blood pressure, and diabetes, they're a silent disease, or sometimes we'd like to call it silent killer, because it goes and damages the eyes, the heart, the kidneys, and the nerves without making any noises. And once the damage is done, then all the symptoms will come up. That's why I always tell my patient prevention is better than cure, and would better be, I tell them, more intelligent than diabetes and hypertension, and take some preventive measures, like check your eyes annually, do a blood test, check your arteries of the heart. The reason they are silent diabetes, because diabetes, as we know, it affects and damages the nerve. So once the nerve is damaged, then the patient will not have the normal symptoms that any non-diabetic patient would have. So a lot of patients that they come who are diabetic, they don't present like a chest pain or chest heaviness. They have other symptoms, and these symptoms needs to be taken seriously.
Well, it's been a recurring theme, the whole prevention is better than a cure, on the previous episodes that we've had in this series. But when we talk about something like high blood sugar, we know it's not good for us, but specifically, how does it affect the arteries and the blood vessels when you have high blood sugar?
Yes, so high blood sugar, some people they say, yes, we have high blood sugar, we'll take medicine and we'll eat whatever we want. And they say, that's the reason why we're taking the medicine. This is one of my patients told me this.
And what's your view on that?
I said, no, because high blood pressure is not only causing the blood sugar to be high, but high sugar cause a lot of side effect and a lot of complication in your body. To start with, high sugar damages the lining of the vessels of the whole body, but we're talking about the heart. So it damages the lining, or endothelium we call it, the lining, the thin layer of cells that is lining the vessels. And if that lining get damaged, then it will be more susceptible to atherosclerosis or plaque formation or cholesterol formation on it. And then that of course leads to narrowing of the vessels, and that will make it more susceptible to clots formation as well. And if a clot gets formed in these arteries, it gets blocked, and then people will develop heart attack or develop a stroke as well. That's not the only thing, but high sugar causes as well other things, like the muscle which is in the vessel of the heart. It causes that muscle to grow, and then when it grows become bigger and stiffer, and that of course lead to other complication like high blood pressure. And then also high sugar leads to reduce of nitric oxide, and nitric oxide is one thing that is in the body and lead to relaxation of these vessels. And when we reduce that, then the vessel gets stiffer and they become smaller, and then again you go into a vicious cycle of high sugar, damage lining of the vessels, high blood pressure, heart attack, blood clot, all of these things.
Yeah, well, it certainly gives weight to the saying of the silent killer, given just how far and wide some of the complications can be. But on that topic of being the silent condition, doctor, how common is that overlap between diabetes and heart disease within the population?
It's very common. And majority of as I said, like in US, for example, 50% of the people who are diabetic, they suffer from cardiovascular disease. And people who've got diabetes, they're more likely to have heart disease 2 or 4 times more than the normal population. And a lot of these people who got diabetes, they die, unfortunately, from cardiovascular event eventually.
Yeah, I know. And that's all part of, I guess, the importance of regular checkups, regular screenings, and that's why when you look at someone who might be presenting or has tested to be pre-diabetic, how does pre-diabetes increase the risk of developing heart disease?
This is a very important question, because the title pre-diabetic, I don't really agree with it, because if somebody has got pre-diabetic, it's basically, they say as a definition of it, that the sugar is not normal and the sugar is not in the diabetic level. So the patient is the borderline. This is the definition of pre-diabetic, but actually pre-diabetic patient, they have, and in my PhD, I did a lot of research about the pre-diabetic and how it affects the cardiovascular and the heart health. Pre-diabetic, it causes a similar thing that the diabetes cause, but it takes a bit longer to develop, but the mechanism is the same. So whoever has got pre-diabetic, they have to consult their doctor, and depending on the other risk factors and on their age and the family history, etc., it needs to be treated in order for them to not to get all the complication that the diabetic patient get. So bottom line, same complication they get at the diabetes, the pre-diabetic patient, but they are underestimated again. And even this time, it's underestimated not only by the patient, by a lot of doctors as well, because pre-diabetic causes heart disease and all the other complications.
Yeah, so the complications, the dangers are still there, and you think that perhaps with that name, people may not be as concerned or feel they need to...
They don't take it seriously.
Take the precautions.
Yeah, they don't say... I mean, yes, lifestyle modification is the first treatment for people who are pre-diabetic. But having said that, they should be closely monitored, and after the lifestyle modification, if the sugar level or hemoglobin A1C didn't come down, a serious action needs to be taken by the doctor to protect them. And as we said, prevention is better than cure.
So on the topic of those lifestyle changes, Doctor, do you have any recommendations on perhaps specific lifestyle changes that can help significantly reduce the risk of heart disease in someone who has diabetes?
Well, lifestyle modification is number one treatment for any pre-diabetic or diabetic patient. And this comes even before medication. What we need, what we mean by lifestyle modification, is your food, your exercise, and then the smoking as well, and then the amount of activity that you do, and stress level, and sleeping. A lot of people, they don't emphasize on the amount of sleep, and they don't know, and they underestimate the importance of sleep for cardiovascular health and the managing of stress. I mean, some patients, they come to me and they say, we work 14, 15 hours per day. That is no good for any system of your body, let alone the heart. I mean, the two very important things. And of course, smoking, we know what to do about it. And the smokers,
Stop.
This is what I tell my patient. I said, you know more than me what smoking does, and I'll tell you, you know what to do with it. I not even to tell you to stop, because you know more than me. And of course, then when we come in terms of food, we need to concentrate on a healthy or healthy diet. What we mean by that is, first of all, I always tell my patient, reduce your food from outside. Just make food at home, so you know what type of oil you're using, how much salt and sugar you're putting in there. And this is very important. Carry your lunchbox with you, so you know if you are working until 4 or 5 o'clock, carry your lunchbox with you. And at least you know the amount of sugar and the salt and what oil, what kind of meat you use, and the quality of the meat that you've used. And then I always tell my patient, you should have 5 portions of fruits and vegetables per day, and then water. A lot of people, they have very low fluid intake. So I'd say 2 to 3 liter, just the base, okay? So 3 liter to 4 if you're a male, if you're exercising, if you're sweating a lot. So that's the amount of fluid you need to take. So, and then avoid all of these caffeinated energy drink. Okay, we can have coffee and tea, but everything in moderation is good. And then your exercise comes with 30 minutes of walking every day, or 150 minutes, we call, of moderate exercise per week. And then we say, don't sit for a long time, 10,000 steps per day, but that does not count for your exercise. That's different. So you need to be active. You don't need to sit a lot. And then strength exercise, weightlifting is good. I don't say lift 100 kg or 50 kg, but I think especially for women, and it helps your heart, it helps your bone, it helps your hormone, it helps your mood, it elevates your mood and reduces your stress, and it helps you sleep as well. So these are the main thing. For the food, we need to concentrate as well on lean protein, high fiber diet, and avoid the fatty and fast food if possible.
Fantastic points, and a lot of doctors in this series have touched on those points of yes, the importance of walking. I think some people perhaps underestimate the impact that it has on the body, but the effects that it does have on the heart. And I think that what you said about cooking in the home, don't eat where you put fuel in the car. You know, it's a case of just making sure you're controlling what you put in the system. And but for anyone who is, you know, as you said, in that situation where they need to regularly monitor their blood sugar levels, just how important is that for someone to monitor their cardiovascular health?
It's very important. All depends on the person's age, family history, if they have any symptoms or if they have any risk factor. So basically the people who have got family history, for example, of high cholesterol, or family history of heart disease, or family history of diabetes, they should be kind of like very on alert regarding even you go and check these levels. Even if you don't have any symptom, don't wait for the symptoms to come. You go and check the symptoms and see if you need any treatment, because as we said, it's a silent disease. It doesn't have any symptoms until it is late. But few people will have symptom high blood pressure, for example, but the majority will not have any symptoms. It's the same for diabetes. Yes, people will have all these symptoms of diabetes, like frequency, going to toilet a lot and thirst, etc. But you don't wait for these symptoms. So I always tell my patient, even if you're well, measure your blood pressure. twice a year. Go and measure your sugar. Go and visit, especially if you have a family history. Go and visit your doctor or family medicine or your GP just for a checkup, especially if you have somebody in the family as well with these conditions.
Yeah, you touched on before that you see some patients who believe that, because they take the medication, that then allows them to eat what they want and socialise, perhaps not in moderation. But what role do medications play in reducing the risk for diabetic and pre-diabetic patients?
Of course, the medication, it helps a lot in normalizing the blood sugar level. And if the sugar level gets normalized, then your eyes, your kidneys, and your liver and your heart, they're happy. But this doesn't mean that I go and have a sweet, because if you have a sweet, there's other things in it as well. There's saturated fat in it and butter and stuff. And they are not good for the cholesterol, not good for the blood pressure. And anybody who's diabetic should only be on a sugar tablet, but they should be on a tablet for the cholesterol, regardless of the cholesterol level, because the cholesterol tablet will not only reduce the cholesterol level, but it protects the heart vessel as well, especially in diabetic patient. And of course, the high blood pressure usually go along with people who've got diabetes and cholesterol. This is, I call it kind of like a package. It goes together. So that's why diabetic patients should go and check their blood pressure, cholesterol. They should have an annually eye checkup, and of course the heart checkup they should have as well.
Is one of the hardest things trying to get across to patients that there's no quick fix, that taking the tablet is not going to solve the situation, that perhaps the old-fashioned eating a great diet and having regular exercise and a balanced life and lifestyle are probably some of the best preventative messages in this situation? How hard is it to get that message across?
Well, it's very important, the lifestyle modification, as I said, and the patient number one, I said, study has found if somebody is diabetic or somebody wants to lose weight, for example, food number one and the exercise is number two. And we should just keep emphasizing, and then awareness. The consultation with the patient is a great chance for the doctor to do the awareness for the patient. But having said that, programs like this and going to the public with these kind of messages and through the social media is a strong tool to bring this across to the patient.
Looking forward, are there any new treatments or technologies that are aimed at reducing cardiovascular risks in diabetic patients that you can foresee in the future?
Yes, there's so many new medications, and we know a lot of medication that is for weight management that we use for diabetic patients. And this is kind of like a new medication, and more are coming. And there's so many other medication that we use in diabetic that has got the protective effect for the kidneys and for the heart as well. And these are new ones in the market, and much more is coming up. We had a recent conference, the European Society of Cardiology, and there were so many new medications coming up, and the technology as well. Like a lot of patients, they use it. Diabetic patient, they use it, and for example, the watches that they use, and they measure their heart rate, they measure their blood pressure, and they measure, even some of them, they can do the ECG, the tracing of the heart.
Wow.
So the patient comes in, and the patient is totally well, and I said, okay, how can I help you? She said, or he says, well, my watch is telling me that my heart is irregular. Go and see your doctor. And this is irregular heartbeat, or we call it atrial fibrillation in diabetic patient. It's kind of like something is detected by these watches now.
So it's not just a gimmick. It actually has benefit.
It does have a benefit. However, we have to use it in a kind of like a medically framed way, because some patient, they come and say, that watch is telling me that my heart rate is very high, 120. I said, what were you doing? I said, I was exercising. I said, that's normal. Or she come and say, the heart is telling me your heart rate went down to 50. I said, what were you doing? She said, I was sleeping. I said, okay, that's fine. When you're sleeping, your heart rate comes down. But these watches are great in monitoring the health, and there are other things that monitor your sleep as well. So these technologies are great.
Doctor, you mentioned the importance to get tested, whether it's your blood sugar, whether it's the blood pressure, whether it's the eyesight. For people who want to do that, how often should diabetic patients undergo heart screenings and cardiovascular checkups?
The diabetic is a silent disease, as we said, so that's it affects the eyes, the kidneys, the heart, the nerves. I tell my diabetic patient at least once a year you should do a urine test, and the urine test you should check the protein in it, and if it's okay, then we can do it yearly, and then if it's not okay, then we refer to the nephrologist, for example, the kidney doctor. And then for the eyesight, at least once a year they should go and check the eyesight, and then the eye doctor can follow up and then advise them accordingly. Then for the heart, if they are, it depends on the duration which they have the diabetic for. If they are more than 10 years, they have good diabetes, or if the diabetic was when they were as a child, diabetes type 1, for example. So all depends on the patient and of course on their age. And then if they have any other risk factor beside diabetes, for example, they have kidney problem or they have high blood pressure. And based on this, we should advise them or how often, but at least come and see your doctor for a blood pressure measure, for cholesterol measure if you're diabetic. And I always tell the patient, the day you are diagnosed as diabetes, come and do a baseline check, and then so we can build up the follow-up on it, and we'll see, yes, you were at level A, and now where are you now at the moment after a year or two, and then depend on how often, depending on these levels, we can just do, I recommend the follow-up for them accordingly to their risk factors and their baseline numbers.
Yeah, I think that's very important, certainly that basic of having a great relationship with your doctor, getting those yearly tests. I often tend to find, especially with my friends, men are so bad at doing this compared to women. They put it off and put it off.
Yes.
I don't think they think if we don't go to the doctor, it might just go away. And that's one of the biggest challenges. Doctor, any advice you'd like to give someone with diabetes or pre-diabetes in some of your final thoughts to reduce their risk of future heart complications?
Okay. Any chest pain should not be ignored. Any chest heaviness or burning sensation, which they don't put it down that I've got acidity. This is especially if you're diabetic. But there are some diabetic, as we said, they will not have chest pain. They will not have any classical symptoms. So any dizziness or short of breath or any fast heart rate, or we call it palpitation, or any syncopal attack, if they have, please do not ignore it. And don't make excuses and say, yeah, this is, I think, a flu that I have, or this is my acidity which is causing this.
I had some chili, it's gone down the wrong way, it's fine.
Yeah, exactly, yeah. So don't do that, please, especially if you're diabetic. And don't wait for symptoms to come. You go and have a regular checkup. If symptoms come, please urgently go. And if you have any symptoms, go and check it and close the chapter. This is what I call my patient. Don't drag it on. I'll go tomorrow or the day after. Go and check it and close that chapter. And then lifestyle modification. You are your own doctor. You take care of yourself. Sleep well. Diabetic, it affects the kidneys. So 3 liters of fluid, at least, of water. I don't mean have a kind of like a sweetened drinks and avoid these. And so go and see a dietitian if you're not sure of what you want to what is good for you and what is not. And the main thing is the sleep. You have to sleep before 12 o'clock. I always tell my patient, and have a deep good sleep. I always tell my patient sleep is very important. Water is important as well, but don't drink any water after 7 p.m. because you need to sleep. I don't want you to get up in the middle of night 3-4 times, go into toilet because you drank a lot of fluid after 6 or 7. And exercise. And
I've also found, I feel like I've got to be my own parent, of keeping the phone not next to the bed.
Oh, yeah.
That's what's been because you look at it, you wake up,
Yeah.
the blue light, it's been disrupting sleep.
This is what I told my husband. I said, you know what we're going to do? We're going to buy an alarm. And then we
An old-fashioned alarm.
Exactly, yeah. And we're going to put the phone outside at least 1 or 2 meters away from us. And then we're just not going to touch it until we get up in the morning. And I tell my patient 2 hours before sleep, stay away from your phone. And of course, we've given so much advices to our patient. We forgot smoking, and we should stop smoking.
This has been very insightful. Dr. Layla Al Marzooqi, thank you very much for coming in and sharing all of your experience.
Thank you for having me.